and I'm going to welcome everybody here to Better with Beef 2022. I need to introduce a few people here tonight and go over a couple ground rules as we get started here. And first, I'm going to introduce the person running the video tonight, and I believe that's Beth Dallaire. She's the Ag and Natural Resources Coordinator in Pueblo County. She's fairly new to that position, but I've appreciated all the help that you've lended to this series, Beth. It's been great. And her boss on the other side of that screen up there, Mr. MJ Fisher, he's kind of the mastermind that got me started into doing this last year during the pandemic. And we've continued, and we're hoping that we're going to go forward and make this bigger and better as we go through. MJ is the County Director in Pueblo County, and he is the Central Region Interim Director for the Extension Region in the South Central part of the state. And with that, I'm Travis Taylor. I'm the Livestock Extension Agent up in the Golden Plains area of Colorado, the 5 counties in the northeast corner. And we're going to start tonight with a discussion on the fundamentals of preventing infectious diseases in beef cattle herds. And we brought in our favorite expert, Dr. Frank Garry, DVM and CSU beef veterinary specialist, I'm going to call you for lack of a better word, Dr. Garry. He was with us last year talking about calving, and we're going to just talk about how to prevent some of those infectious diseases tonight. So Dr. Garry, when you're ready, I'm turning this over to you tonight.
Okay, super. Thank you, Travis. Thanks to all of you who are attending. I need to navigate just a couple things. So I need to do the screen share. And let's see, share, yes.
And while Dr. Garry's getting all his slides set up, I'm going to remind everybody that if you have questions, put them in the chat feature on Zoom tonight, and we will cover those at the end. That way you don't forget it, because we're going to let Dr. Garry kind of roll through his presentation and hopefully have enough time at the end to share with you guys. And if people want to hang on and just talk to Dr. Garry, we've got that ability too. So with that, Dr. Garry, when you're ready.
Sure, thank you. Yeah, and to just reiterate what Travis said, my intent would be to take 45 minutes, probably, of presentation. I think that's a reasonable time. That should leave like maybe 15 minutes at the end. But as I told Travis, you know, we don't want to hold people longer than they want to be there. But if people want to ask questions beyond that, I am happy to offer you time to discuss stuff. So, so with that said, what I want to talk with you about, what I talked with Travis about presenting, was fundamentals of infectious disease prevention of beef cattle herds. And so I'll start with, I gotta move something here. There we go, great. With a quote from Will Rogers, right, which I hope brings a little bit of humor. Good judgment comes from experience, and experience comes from bad judgment. You will all know there's a lot of truth to this, and probably one of the best teachers is experience. However, I want to challenge you to think about something. Is that the only way to learn, or is it possible to learn ahead of time and say, you know, I know some things and I could potentially prevent the bad experience that's going to give me better judgment in the future and avoid a lot of headaches ahead of time? And I would suggest that a lot of us wait until something happens rather than circumventing that bad thing happens. And so what I was going to talk with you about this evening is intended to get you thinking about things. I'll share that I enjoy not presenting radical new information and all kinds of graphs and charts about new research that we've done, but rather take some things that I will guess you know for the most part. I'm expecting that of all the stuff I'm going to share with you this evening, much of it is stuff that is at least passingly familiar, if not intimately familiar to you. And then the question comes, if those things are true, and if you know them, then why do you do what you do instead of doing something that's maybe a little bit better for your operation? Okay. Oops. Here we go. And so the first thing I want to do is suggest that if I could do anything this evening, I want to connect ranchers more closely with your veterinarians. I believe that the majority of ranchers underutilized veterinary services. And the reason I say that is because I'm very familiar with the concept that you call the vet when something goes wrong. And when that something has gone wrong, then what you hope is that the person is going to come and correct the problem. And of course, this works if it's something like a cesarean section, or if you do have a sick animal or something like that. But the truth is, I think I can accurately say that you are underutilizing what the people that I teach here at the vet school are fully capable of. And so I've listed them here. The most important reason to incorporate a veterinarian in your operation more thoroughly is because they can help you improve profitability. And they can do that by doing 3 different types of service that many people don't avail themselves of. The first is to increase herd income. And the way you do this is by incorporating technologies or strategies that enhance reproductive and growth efficiency, and therefore improve the market value of cattle sold, typically with somewhat the same overhead costs that you already have. So if you can increase revenue in the face of trying to keep costs down, you increase the chances of profitability. Second, veterinarians can help you control costs with some things that relatively few people do. And I know this based on, one, talking with producers, also talking with veterinarians, and then looking at national surveys and seeing what kind of services producers avail themselves of. So a great example is nutrition. You're going to gather some feed in the fall that you're going to use during the winter. And what many people do is say, okay, so here's my hay supply, I'll buy some cake, I'll buy some minerals, and then I'm good to go. If you don't integrate that into an assessment of the body condition score, the relative nutrient quality, and the micronutrient content of the feeds you have, if you don't do feed analysis, then you could be overspending, you could be overfeeding, you could be underfeeding, you could be producing problems that didn't need to occur in the first place. So you can control costs and enhance health by proactively looking at things that can be done before you actually enter the wintertime, okay? And then there's the third thing, and that's the one that's going to be the focus of this talk, but it's just one of several things that I think are underutilized, and that's protect the herd from biologic and economic losses, which means developing strategies that diminish the likelihood of infectious disease occurrence, or if it is going to occur, limiting its occurrence rather than waiting till it occurs. Now, the truth is, it is true. We as producers and as veterinarians also need to trick sick animals, but there's just no question that that is the lowest possible return on investment. And I'm all too familiar with the concept of, yeah, well, I would have gotten a veterinarian, but that's really too expensive for this problem. In other words, instead of preventing the problem, you allowed the problem to become something that then became way too expensive to treat. So with that as an introduction, what I hope to do is suggest to you that a lot of the stuff I'm going to present here is stuff that's well within the capability of, or within the purview of a good client veterinary relationship that actually works at those top 3 things rather than at the bottom one. The bottom one is an obligation. The top 3 are opportunities, okay? So what are the important diseases that we might be talking about? Well, it turns out that there's a laundry list of possible things we could talk about. There's metabolic diseases. These are things like grass tetany. There are nutritional problems. These are things like micronutrient deficiencies or protein energy malnutrition. There are some toxicity problems, particularly for range-fed cattle, where we have exposure to things like toxic plants, as well as other toxic chemicals. Reproductive disorders, things that contribute to suboptimal performance, infectious conditions. Where we're going to focus today is going to be on the infectious conditions, and there are several reasons for that. And this is why. Because they're a special area of concern. All of those disease conditions or things that impair health are important. But infectious disease has a very special niche. Because one, it is one of the most common contributors to ongoing losses, things where you have endemic diseases in the herd. It is capable of producing explosive new problems. If you introduce, let's say, BVD into your herd when you didn't have BVD there before, then you find out about it when you all of a sudden find out that you have 20% of your cows open, or when you have aborted fetuses, or when you have calves that are abnormal, all right? It's a public health issue because it interrelates to those things that are of special concern to the public at large. And very commonly, not always, it's introduced into the herd. So these are the types of things that make infectious disease special. I want to delve into two of them with a little more detail, again, with things that I think most of you are already pretty familiar with. When we talk about infectious disease losses, we're talking about the cost of treatment. That's a loss. It's something that you incur because the disease has occurred. You also then have reduced production. Virtually any animal that gets sick is going to lose production at some level. If it's a sick cow, it might lose its calf. If it's a sick calf, then it's going to have a liability of a period of time when it's not growing normally. And while you might think, oh, well, there can be some compensatory growth, that is as much of a myth as it is a reality. Very few calves that get behind by not gaining 2 pounds a day for a week because they have scours, all of a sudden gain more weight later. They typically remain behind, which means you lost an opportunity. Then there are overt animal losses. Some diseases are going to kill things. And these diseases are really common. These are diseases I assume you know of from personal experience or at least from reputation. BVD, bovine leukemia virus, salmonellosis, Johne's disease, respiratory diseases, calf scours, etc. So a wide variety of different types of things that all represent infectious disease challenges. I also said that infectious disease is important because it represents a public health issue. And these two will be familiar to you. One is that some of the diseases of cattle are also zoonotic concerns. A zoonotic disease is one that's shared between species. And so there are a number of things that can be either shared through food safety breakdowns, through contact with animals, through environmental contamination that then potentially spreads to other areas, for example, through waterways. Then there's the issue of antibiotic residues. Antibiotic residues, excuse me, is that group of problems that we developed BQA for back in the late 80s, early 90s, because the public at large said, I don't want to eat meat because it's laced with antibiotics. Well, we've done a lot better, but the truth is we aren't perfect. And when you're going to use antibiotics, you always have to be thinking about antibiotic residues and the notion that people won't eat as much of a particular thing because they're concerned about those things. So we've got food safety issues, and then we also have the potential residual of antibiotic contamination of the environment that then affects environmental issues, which we also take black eyes for. And then the last would be antimicrobial resistance. And many of you will probably, shrug, roll your eyes, shake your head. Yeah. Everybody wants to believe in antimicrobial resistance. Well, the truth is you're already familiar with this. Years ago, we used to be able to treat respiratory disease, for example, with things that were relatively inexpensive, like oxytetracycline. Now, we have to use Zactran, or we have to use some other advanced macrolide, which costs you much more than oxytet. Why? Because a lot of the bugs are resistant to oxytetracycline. So it affects us as much as it potentially represents a risk to the public at large. So that you know, it is clear to the CDC and to other places that the majority of antimicrobial resistance problems do come from human use. Our industry is not as responsible as some people would like to think. But that aside, perception is important, and the reality is that overuse of antibiotics does enhance the development of antimicrobial resistance, which is bad across the board. So there are a whole bunch of reasons why we need to be thoughtful about infectious disease. So with that in mind, then, how do we manage infectious disease on beef cattle operations? Well, I'm going to say that there are 3 primary tools that we use. One is treatment protocols, which usually means antibiotics, vaccination strategies, and then biosecurity and hygiene management. And I want to explore each of these 3 control methods and then get you thinking about why you rely almost exclusively on number 1 and 2 and relatively little on number 3, while in fact, number 3 is far and away more effective, far and away more cost effective, and very straightforward in terms of adapting management to decrease the probability that you need to use 1 and 2. So let's look at antibiotics first. I already mentioned that antibiotics represent the risk because of residues and because of resistance. But beyond that, they also are pretty expensive. They don't always work. They work only against bacteria, not against viruses. So if you have viral diseases like, for example, BVD, antibiotics are of no use whatsoever. Antibiotics in general are overused. Why? Because if an animal shows signs of a particular disease, the first thing you're going to reach to treat it with is antibiotics. And that will be true whether it's a viral disease or whether it's a bacterial disease. The most common place where this is used is in, for example, treating calf scours, the vast majority of which is caused by viruses and cryptosporidia, neither of which are responsive to antibiotics whatsoever. And yet we use them frequently. So we add cost, we don't do anything effective, and yet there we are. But perhaps most important is that antibiotics are like that second slide I showed you. Antibiotics are a treatment after the disease has occurred. It has no role in preventing. Now, they've been used across a broad spectrum of things, but there are no legally approved preventive applications of antibiotics. And so we don't use them that way. So from the point of view of preventing infectious disease, yeah, antibiotics really aren't going to get the job done. They're useful. We don't want to throw them away, but they're a challenge, okay? In the end, you got to ask yourself the question, which is going to be better, treatment or prevention? Which is more effective? Which is more costly? Which is more desirable? And so I'll just share a thought experiment with you. I don't know how old everybody on this call is, but some of the people on this call are well within the range of the high occurrence of heart problems, specifically things like heart attacks. Here's the good news. We are so far ahead compared with where we were 10 years ago, and we were further ahead then than 10 years before that, and then the 10 years before that. If you do have a heart attack, we have the technology that you have a much better chance of surviving today than you have ever had in the past. Here's something else that's true. It'll cost you at least 6 digits of money. You will never be the same. You still have a high risk of dying regardless of the technology. And there was an alternative. And the alternative would have been preventing the heart attack. You can't assure that, but diet, blood pressure, control, exercise, those are things that you can actually control to diminish that effect. Which one is more effective? Which one is more costly? Which one is more desirable? All right. So if we're looking at prevention, then your next thing is going to be to reach for vaccinations. So what do they really prevent? Do they prevent infection? Those of you who've now lived through 2 years of a pandemic should know, and it is no surprise whatsoever, that when we vaccinate against COVID, when we vaccinate against BVD, when we vaccinate against any of the other diseases we vaccinate against, we don't typically prevent infection. What we do is we change the immune system so that when the infection occurs, the immune response is a lot more effective. It is not a giant shock that infected animals and or infected humans, or excuse me, vaccinated animals or humans can get infection. The question is, what happens as a result of the infection? And then there is a limit to how effective the vaccines can be. They do some really good things, but you can't vaccinate disease away. That's just not possible. There are very few vaccines that have ever been made that are so rock solid that if you have them, you won't get the disease. I can count them on one hand. A good example might be tetanus, okay? And you haven't even prevented the infection. You've prevented the effects of the toxin, okay? So what vaccinations do is they increase resistance, and they only increase resistance against specific agents towards which they are targeted. And since we don't have vaccines for many of the important infectious diseases, that means they have a very limited scope of efficacy. They modify disease occurrence. They decrease shedding of disease agents. Therefore, they are a useful component of disease management. Therefore, it always makes me sad when the phone call that I get from somebody who's just lost X number of animals, make it 5, make it 10. The first question they ask is, what should I do to change my vaccine strategy? And my answer is, well, first of all, we need to know for sure that we're dealing with a disease. Second, we need to know if we have a vaccine against that disease. And third, you're not going to change the outcome of this disease right now. What you got's what you got. And you can't vaccinate enough to prevent it. In the face of a BVD challenge in a herd, you can vaccinate as much as you want, but sooner or later, some animals are going to get BVD if you have a PI in the herd that's shedding inordinate levels. And that's because the risk of infectious disease is a balance between resistance and exposure. And so here's a little graph to show you something about how this works. There's a level of resistance and there's a level of challenge, which is exposure. As long as the resistance is higher than the challenge, we don't end up with disease. But in normal biological systems, that can't always be maintained in the right balance. And so there will either be times when you have lower resistance for a bunch of biological reasons, or you end up with greater levels of challenge. And that's when you get clinical disease. So our job is to try and keep resistance as high as possible, but also diminish exposure. Vaccines can help with one arm of that, but it can't help with the other. And if you always do the same thing, and the only thing you use for prevention is vaccines, well, then obviously you are going to continue to face challenges. You'll always get what you always got. So this brings us to that second slide I showed you. What is the role of producer in dealing with infectious disease problems? Most commonly, and I apologize if I'm insulting anybody here, but hopefully I'm just getting you to think, many producers react to problems and then consider themselves victim of circumstances. I can't believe I've got BVD in the herd. Well, I can believe you got BVD in the herd because you buy animals from a sale barn, you didn't proof check them, you didn't look at the herd of origin, and you didn't check for PI status when you introduced them into the herd. This is not a giant shock. You do that enough times, you will get BVD or Johne's or bovine leukemia virus, okay? Or you could be a proactive manager of optimum health with active use of consultation, which then brings you back to the question of the veterinarian. So the veterinarian typically is targeted, and a lot of veterinarians see themselves this way, as service providers. So if the producer defines a need, then they call the veterinarian, the producer goes and takes care of that need. But what it assumes is the producer sees the need. So if you don't see the need for help preventing BVD, okay, then you're not going to call the vet, and you call the vet when you have BVD. That's backwards. I think it's really way better to invest your time to develop a relationship with a veterinarian where you go through and say, so let's talk about how we might prevent this problem. Could you work with me in a quasi-management role? I'll guarantee you that most veterinarians I know are uncomfortable with the notion of going to a producer and saying, hey, could we change our relationship? And I'm going to be a consultant for you, because they know what most producers' answer will be, which will be, no, I'm not going to do that. So this is a two-way street. And I try to work with veterinarians and with producers and try to get both ends to meet in the middle. And I believe that the conversation can be started most adequately by a producer calling the vet and saying, you know, I really want to think more closely. I'm about to expand my herd. The drought is over and I need to expand my herd. How am I going to minimize the likelihood that I introduce disease that eats up whatever profit I was going to get by expanding the herd? Okay. So I throw this quote in there because I think it's true and it's funny. It's a quote from me. And I was honored that a colleague of mine heard me present something sort of like this and then quoted it. And I said, yeah, it actually is a pretty good quote. We find it easy to do what we're asked to do. We find it harder to do the things that need to be done. And that really is the mainstay of what I'm trying to present to you here. So in epidemiology, we look at what we call an infectious disease triad. That is the things that influence the occurrence of infectious disease. So we have host factors, we have agent factors, that's the bacterial or viral agents, and we have environmental factors. When we vaccinate, we are helping the host, but we're not doing anything about the agent, and we're not doing anything about the environment. Biosecurity is the name that's been given to the management and hygiene practices that decrease the risk of introducing or spreading infectious disease agents, which effectively amounts to reducing animal exposure. Now, a true purist would say biosecurity is keeping the disease out, biocontainment is keeping it from spreading within the herd. And yeah, okay, I'm just going to wrap them all into good management using biosecurity principles. Because biosecurity is way more powerful than vaccination. Management that reduces disease agent transmission is effective against multiple disease problems. So if you prevent fecal oral spread of disease, let's say to baby calves during calving season and the spread of scours, you are also decreasing the occurrence of salmonellosis. You are also decreasing the risk of Johne's disease spreading in the herd and so on. In other words, unlike vaccines, they're not single agent dependent. They also are the most important tool for decreasing those public health concerns, because appropriate application, prevention of the disease, minimizes the use of antibiotics, decreases the problems with residues, decreases the problems with resistance, and also decreases exposure of human populations to the bugs that cattle can share with them. So that's very powerful. And when we look at it that way, we can change this triad and look at biosecurity as preventing transmission, increasing immunity, and eliminating agents. And that requires then that we set some goals, do risk assessments, develop a plan, implement it, and monitor it, okay? And basically, we can develop, and we've done this for many diseases, and I would like to suggest if your veterinarian is not up to speed on how to do this today, they sure as heck know the background principles of it, and a little bit of background reading or consulting with some other resources, they can help you do this. There are 4 steps in an infectious disease control program. The first one is education of the producer. Why? Because you actually do need to know some stuff in order to make decisions. And so the first step is, do you understand what this disease and how it transfers? I feel really strongly about this. And the reason is because in my own personal experience, when I was a young guy, I used to think, man, I'm great at solving problems. Here's the truth. I can't solve one of your problems, not one. There's only one person that can solve your problem, and that's you. What I can do is help inform you about the variety of possibilities there are so that you can make choices. If I come onto your operation today and I say, here, you need to do this, Bob, you're going to say, yeah, right, you're blowing smoke. Or you're going to say, I'm not listening to that guy. Or you're going to say, well, I can't do that because of this. Well, right, I can't know the intricacies of every operation and how you do things. What I can do is show you what needs to get done. There's a famous quote by George Patton who said, never tell people how to do things. Tell them what needs to get done and let them surprise you with the results. The second step is, after you understand the basic principles of a disease, to do a risk assessment with the veterinarian that says, so where would we be at risk of introducing it? Or if I can't prevent introduction, of spreading it. And then you develop a management plan that says, okay, here are the things I could do that decrease the likelihood of me getting it. And it's only then that you deploy a testing strategy that helps you implement the management plan that you've set up. So the things you would need to know, and I'm not saying you got to go look them up, and you don't need to know every intricate detail. You need to know the big picture. How does it spread? What's the duration of the shedding of an infected animal? Does this particular disease include a carrier state? What is the screening test reliability? If I wanted to see where the disease is, how well would the tests work in identifying infected or shedding animals? And what's the current status of my herd? Those are the things you would need to know. I'm going to give you an example at the end of this, which is Johne's disease. Johne's disease transmits in a certain way. It has a long duration of shedding. In fact, for pretty much the remainder of the animal's life after it starts shedding. Carrier states are a big deal. So if you bring an animal into your herd and you sequester it, isolate it, actually you're doing no good with Johne's disease, because as soon as you introduce it to the rest of the herd, it's going to do what the perfect parasite does. So there's a whole bunch of methods that we can deploy. And at first, of course, they'll look pretty daunting, except that really they're very simple. When we understand the diseases, we know which ones of these are going to be effective. So we have animal importation controls. Which ones will be effective against particular diseases? Can we screen the animals? Can we quarantine the animals? Can we vaccinate the animals to prevent them from spreading the thing? We have issues that relate to entry of your operation. We have issues about animal contact and how the disease spreads. Feed source control. Feed source control is the #1 preventer of Neospora, because it's an ingested bug that comes typically from dog poop, because the dogs have the bug, they spread it through, and so if you don't prevent dog poop from entering your feed supply, then a certain number of cows will, with some likelihood, end up with Neospora abortions. Body excretion contact. And then there are a number of other things that have to do mostly with disinfection and or hygiene, like newborn calf management, disinfection and hygiene of working areas, manure handling, environmental management, and of course, disease identification and monitoring, and the elimination of high-risk animals, the animals that might be shedding. So each of these will have a role in some particular element of a disease. And if you know what your goals are and what types of diseases you want to prevent because they're important to you, then we can decide which of these get deployed at a particular time. The reason for that is because in the world of infectious diseases, there is no fail-safe. There are risks that come from a variety of different places. So what we do is, much like the food safety system, we put multiple hurdles in place. If I can diminish the likelihood here, and I can diminish the likelihood there, and I can diminish the likelihood yet again over here, each one of those steps multiplies against the other and reduce risk so that in combination, we can end up with incremental improvement of the likelihood of actually preventing infectious disease on the place. So what diseases would fit this kind of a strategy? What would be my priorities? The priorities I would see, I mean, there would be a laundry list of infectious diseases, but the ones that are reasonably common in beef cattle, reasonably straightforward in terms of their control, and very important to beef producers. They're not like one-off weird things like, say, anthrax, all right? They don't wait 20 years and then pop up and there wasn't much you could do about it. These are all diseases that can be controlled. Johne's disease, calf scours, salmonellosis, trichomoniasis, BVD, and some of the respiratory diseases. That's a pretty good litany of things where good management can decrease the likelihood of the occurrence of that problem. So why don't we use them? And I'm going to suggest that the reason is the same quote that I started with from Will Rogers, because experience is actually what teaches most of us. And I think that for some of these diseases, once you get Johne's disease in your herd, you will be a very sad person about not having prevented it to begin with, because I've worked with that disease a long time, and I can assure you that it will take you probably 15 to 20 years to get rid of the problem if you are really avid in pursuing control measures. And that's a long time, and it takes a lot of money, a lot of time, a lot of effort, and you would have been way better off to never let it get on the operation to begin with. So I want to talk a little. I want to contrast, if I have the time, two diseases, all right? I'm going to go through these relatively superficially, but it's because they're contrasting. Johne's disease, we can exclude from operations. It doesn't have to be there. And if we can keep it out of an operation, that's your benefit because you don't want to deal with this disease. And then I want to talk a little bit about calf scours, if I have the time, because that's a contrast. That disease is, the bugs are native to mature adult animals. You cannot keep it off the property. It is on the property right now. It's being shed in small quantities. So what we do is we decrease the spread amongst susceptible calves. Very different strategies for different diseases, and yet, because of biosecurity, with a substantial amount of overlap. The things we do that minimize Johne's spread are also the things we do that minimize calf scour spread. So very different disease groups, very different control strategies, but a lot of commonality between them as well. So Johne's disease. I'm hoping many of you have heard something about Johne's disease in the past. There were a lot of educational campaigns that we conducted in the late 90s through into the early 2000s. Sadly, the beef industry didn't really team up with us a lot on this. And so there are a lot of beef producers that only find out about this disease once they have it. Trust me, you don't want to be that person, okay? It's a chronic bacterial infection. When I say chronic, it has a long incubation period of 2 to 10 years. So from the time of infection until you'll see clinical signs in an animal, it will occur in a baby calf, and then you will not see the disease until they're 2, 3, 4, 5 years of age. The causative agent is MAP, Mycobacterium avium paratuberculosis. I'll talk about that in a minute. It primarily affects the intestinal tract. So the primary signs we see are weight loss and diarrhea. But it also disseminates to other tissues, which is important because that makes it a potential human health risk. It also affects all of the wild and domestic ruminants and a few other species as well. Because it's a mycobacterial disease, it has similarities to the other bugs that are in its family, the primary ones being tuberculosis and leprosy, which means they have very slow bacterial growth, very poor response to treatment. We can treat humans with TB. None of the antibiotics approved for TB and or Johne's treatment would ever be used in a livestock operation. Very poor vaccine efficacy. Some people consider TB to be the #1 human pathogen in the world globally. If we could develop a good vaccine against this easily, it would have been done by now, but it hasn't been. And it's because it's a very tricky organism, all right? We diagnose the disease either by disease development or by identification of the agent that's being shed, or by the host response. That would be things like taking blood and looking for antibodies in the blood, okay? And so it's very similar to these other things. In fact, Johne's disease is the standout example. When I say slow bacterial growth, it is the single slowest growing pathogen in either human or animal medicine combined. If we want to culture this bug, it takes us a minimum of 2 months to culture it. For most of the agents we work with, we can grow them in cell culture or grow them in bacterial culture in probably 48 hours for the vast majority of the pathogens. 48 hours versus 2 months. This is a very slow growing bug, and that is why it's so insidious and chronic in a herd. It has a big difference in its susceptibility based on the age of the animal. So baby calves are uniquely susceptible to this agent. As the animal matures to adulthood, it becomes more and more resistant, not with a vaccine or with prior exposure, but because of the nature of the cells that take the bug up in the gastrointestinal tract. And so baby calves take a relatively little amount of the bug to become infected, but then they don't show it to you until they get to be old. If you took the same bug and fed it to adult cattle, we don't expect them to get infected, or at least not infected to a degree that sheds the agent or ever develops disease. So we don't worry much about shedding between adult to adult. We worry a lot about shedding from adult to baby. The bacteria get to the gut lining because it's eaten by the calf. Then it spreads to the lymph nodes, and after a very long period of growth, it gradually begins to create disease in the animal. It escapes body defense mechanisms, and there's a minimal body response, which says that if you have an infected baby calf or yearling, or if you buy animals at the sale barn, you cannot tell that they're infected because we can't find the bug at that stage of the infection with the tests that we have available to us now. When it does begin to show clinical signs, then you get these animals that don't show fever, they don't feel horrible, they basically just lose weight and or show diarrhea. Most common is both diarrhea and weight loss at the same time. But we can get animals that lose weight without diarrhea and animals with diarrhea that are still in pretty good flesh. Other exam findings are unremarkable. They don't have a fever, they don't have an acute onset of disease, and they don't feel poorly, okay? In fact, to relate this to TB, some of you may know the colloquial name for TB is consumption, because people with TB otherwise feel fine. It's just that they're gradually losing ground, getting skinnier, have a cough, and ultimately succumb to the disease. Very, very similar type of progression. With advancing infection, we have increased shedding of the agent. So the more infected the animal becomes, the more bugs it has, the more of it sheds in the feces into the environment. And it also disseminates to other body regions. And that's important because it means that although feces, poop, is the primary means of spread, we can spread it to calves through other means as well, okay? And it also means that we have implications for testing. The number one way we test for this is typically by collecting feces and looking for the agent in it. So the spread of TB, of para-TB, which is MAP, which is Johne's, within herds, because it disseminates to other parts of the body and traffics in the cells, we can get calves born from infected dams that are highly infected that already have contracted the infection in utero. Typically, we expect that in highly infected dams, the transmission to unborn calves is probably in the neighborhood of 30%. Then postnatally, the calf has to, would be exposed through a variety of means. Primary one is feces, but if it's its own dam, she will also secrete it in the milk, she'll secrete it in the colostrum. So if you were the calf of a heavy infected animal, the likelihood of you escaping infection with this bug is very small. Between herds, however, the number one mean of spread is infected animal import. If you do not bring animals in that have Johne's disease, the likelihood of it coming in through almost any other means is very, very small. And the biggest concern that some people have about this disease is that it appears to have zoonotic potential. There's a disease in humans called Crohn's disease that has very strong similarities to Johne's disease. And some of the medical community is convinced that this is because of an infection with MAP. Other people haven't bought into that yet and see it more as an immune-mediated problem, Crohn's disease. And so that argument is not yet resolved. At the present time, therefore, it is not a programmed disease. There's no indemnity, so it's totally up to the producers to control this problem. But it is important to realize that down the road, that could change. And that will be one more black eye for the industry, is that we're creating Crohn's disease in humans. I can talk to you at any length you want about Crohn's, but I'll leave it at that for now. So here's a couple good images for you. This is the baby calf being born to a dam. In case you didn't notice, the vulva and the vagina are just south of the anus. So newborn calves, as they're born, typically will already be contacting feces. And if the feces contain the bug, that's their first inoculation right there. If they don't get it there and they're paired up with the dam, and the dam is heavily enough infected, then she's going to shed it in the colostrum or in the milk, or it will be on her hair coat. And therefore, that calf has a very high likelihood of getting it too. But you won't see it in that calf until the animal is 2, 3, 4, 5 years of age. So the transmission to herds is primarily through import or purchase of cattle. The way we control it is with 3 steps. Avoid introducing infected animals, reduce the risk of spread to susceptible animals when it's in the herd, and eliminate the infected animals. The latter 2 are a lot of management, a lot of time. Therefore, what you want to do is not let it get into your herd to begin with. So how do we address that? I already told you that if you bought yearling heifers and you test the heifers, you're sort of wasting money, because even if they're infected, you're probably not going to find it. In a very small number of animals can you find it in very young animals. So we primarily need to know something about the herd of origin. So if you were buying cattle, the most important question you'd want to ask, buying bulls, buying heifers, buying mature cows, is, do you know about Johne's disease? Have you ever tested for it? Do you have it in your herd? And yet very few producers ever ask this question. And if you don't ask, well then, potentially, we live in a country of buyer beware. That person doesn't have a legal obligation to tell you. And it could be that the person has it but doesn't know it. So if you don't ask and you don't find sourcing cattle from places that have low risk of Johne's, sooner or later, you're going to introduce it. So that's what I have to say about Johne's. So you can see that the emphasis here is on preventing introduction. If you do have the disease, now we have a whole bunch of management things that we have to think through to limit the spread within the herd. This website here is sponsored by my good friend Mike Collins up at the University of Wisconsin. He's probably in the country the premier Johne's expert, and he runs a website that's found here at johnes.org. So you might want to make a note of that. And you can find all kinds of other information, and you can find out about Crohn's disease, and you can find out about management strategies, and there's a whole bunch of resources there for you, okay? And I should ask Travis. I could talk a little about scours here, Travis, or should I stop at this point? Are there any questions in the chat?
How long are you going to take?
Oh, I can probably do it in 5 minutes.
Let's talk about scours, because I think that is relevant here to contrast.
Okay. And I knew this might happen. That would carry me to about, well, that'd be 45 minutes because we got started about 25 of, but so learning issues for scours. I'm not going to go into great detail here, but I mostly want to contrast it with the problem with Johne's disease. They're both spread by feces, but one you can exclude from the herd. The other you cannot exclude from the herd. Far and away, the most common cause of calf diarrhea are cryptosporidiosis, rota, and coronavirus. That's calf scours. All of these are resistant to antibiotics because of the nature of the bug. They most commonly occur between 1 and 2 weeks of age, so they occur in little baby calves. They hurt or kill calves by causing fluid and electrolyte loss. So the primary treatment is not to combat the disease with antibiotics, it's to replenish the fluid and electrolyte loss. That's how you save calves. The antibiotics have no efficacy here at all right? There are some other diseases that will cause diarrhea, and those include bacterial agents like Salmonella and E. coli or Clostridium. But those aren't typically classic scours agents. Those usually invade beyond the gut lining and cause more severe disease. You can distinguish between calf scours and E. coli scours with some relatively simple physical exam tests. But another feature of it is that if you have this in your herd, you can see a distribution within calves that is much broader. It's not 7 to 14 days. It's now something like 3 to maybe 30 days that occur. These kill calves through a completely different mechanism. And for these diseases, antibiotics are useful. Sometime in the future, if you'd like, we can go through all of that in great detail. But for now, the point is that these are common pathogens carried by dams, cause disease in calves, all right? If you're going to diagnose it, therefore, it becomes really important to know, am I dealing with rotavirus, coronavirus, cryptosporidiosis, or am I dealing with Salmonella, E. coli, or Clostridium? The most underutilized tool in all of ranching history and in veterinary medicine is necropsy. This actually can really easily zero you in on what the cause of diarrhea and calf losses are in your herd. And it's really underutilized, which emphasizes the point I made very upfront, which is having a good relationship with your veterinarian and or having the ability to do necropsies yourselves and communicate with the veterinarian are really important skills to distinguish between these different groups. But what the groups have in common is the way they spread, all right? Oops, I'm going to skip that. The primary means of spread of all of those diseases is fecal oral spread. And once it is in a population, the calves become little incubators and they produce more and more of the bug. You guys actually know this from your own experience. Typically in the first 2, maybe 3 weeks of the calving season, you almost never see scours. Why? Because you don't have calves that are replicating the bugs yet, spreading it to other calves, and therefore causing a big outbreak. Most scours cases begin probably in about the 4th week of the calving season, maybe 3rd, and then they escalate from there. Why? Because the calves are congested together in areas where the calves that are multiplying the bug can therefore contaminate the ground, contaminate the other calves, and spread it to them. So the way we work against this disease, yes, we can vaccinate, but that's not the only means of maximizing resistance. We're talking about a group of things like dystocia management, calf care, colostrum management, optimum nutrition, and vaccine. That optimizes resistance. The most effective way to prevent scours is to minimize exposure. That's the #1 tool you got. The bug is going to be there because the dams have it, and they're going to shed certain amounts of it, and then the calves are going to amplify that. We call this a propagated epidemic, okay? And so the key thing, and the one that's most famous within the beef industry, is the Sandhills calving system, which basically says, we know we're going to have the pathogen. So what we do is we calve cows here for a while, and then we separate and calve cows separately in another place so that the baby calves that could be exposed to the agent are not exposed to the agent from the older calves that have multiplied it. Then after another week or 2, we move all of the uncalved cows to another pasture. Now, this requires some thought, some management, some fencing, but it's extremely effective. There are other ways to accomplish the same thing. But the point here is, notice how different this disease is in terms of its prevention from Johne's disease. They have some overlap, but the one we can exclude, the other we have to deal with. And that can be easily managed. And the most effective tools you have are really hygiene, animal movement, and decreasing exposure to the pathogen, okay? And so that just brings me to my last quote. This is my last slide that I happen to really like because I'm a big fan of Sherlock Holmes, Mr. Disease, Mr. Detective. It's a capital mistake to theorize before one has data. Insensibly, one begins to twist facts to suit theories instead of theories to suit facts. So what you need to do for each of these diseases is explore what they are, understand whether they're occurring in your herd, and then develop a management strategy that works around that, and make sure you know what it is you're dealing with and whether the control methods you have are effective. And that's what I had to present, and I hope that was useful to you. And I'm happy to open it to questions.
Are there any questions that anybody would like to ask of Dr. Garry this evening? You can unmute and ask if you want to talk with him. I think he prefers that than trying to read questions and answer it.
That's true. Although I did just pull up the chat just in case, but I'm not the best at looking at chats. A lot better at answering questions that people ask. Oh, I'm hearing crickets.
And there,
Dr. Garry, this is Curtis. Hey,
yeah.
there's a product called biomass that's sometimes touted as a way to decrease the amount of exposure to scour organisms. Can you comment on that?
Sure. Yeah, I'm familiar with biomass. It's used a lot in dairies because the perception is that what it does is decrease the potential for especially bugs like salmonellosis to invade into the tissues, because it's designed, or the notion is that it actually helps flush it out of the GI tract. To my knowledge, Curtis, there is no published information that actually shows efficacy of that. There are a lot of anecdotal reports, and of course, the people who market it would like you to believe it's a wonder drug. My sense is, because it's not really expensive and because it certainly doesn't do any harm, that it probably, it probably has some efficacy. I don't think it's as highly effective as people give it credit for. So in the face of really congested calving areas, it's also for dairies, it's not that hard to do because you can mix it into milk and you're always administering the milk. For beef calves, it's a little harder to really get administration at the really key age times when calves would potentially need it the most for the enteric agents, because they're mostly on milk. And of course, it's a little hard to milk biomass into milk. So I'm sure there's some other strategies, but I don't know that they're particularly effective at getting really good dosage. So I hope that explains to you. I'm kind of neutral on that because I don't see great evidence that it's effective. And I really don't see really good methods for assuring that it's applied in the time when it's going to actually, when it potentially would have the most efficacy. Have you had experience with it, Curtis?
Not personally. I just get questions about it all the time. And I've always had my doubts, because mostly what they're working on here is feeding it to the cow and say it's going to protect the calf. And I just couldn't see how that was going to work.
No, that, to my knowledge, that's ineffective. The notion would still be the same, but that's sort of bullshit and innuendo, where you say, oh yeah, well, that'll decrease shedding of the pathogen by the cow. And I don't know of any information that says that that's true. But, crazier things have happened. So I don't want to say I know it's not effective. I just have never seen evidence that suggests that it is. That said, I've dealt with a number of dairies that have salmonella problems, and 201, they, institute biomass feeding. They mix it in with the bottle of milk or milk replacer that they're feeding. And so the administration is really not very difficult. It's not very expensive, and they think it does some good. Like so many things, if you make 5 changes at once, it's a little hard to decide which thing was actually effective in diminishing disease transmission. So, personal opinion, but I think it's reasonably sound.
Thank you.
Yeah.
I'm gonna back up Dr. Garry's there. The clients that I've had that have used biomass, that's their hardest part, is how to get it into a calf at the correct timing. So
right, and it's not going to go through the milk. The whole point of that product is to influence the microbiome of the GI tract. And so if you don't get it into the calf's gut, then efficacy has to be, in my mind, 0. And the cows do shed the agents, but who really replicates it, especially in the case of things like rodent coronavirus, is the calves. They're like just little tiny incubators, and I have some statistics. I didn't put them in these, but I could pull up my slides again. And it's a phenomenal number of disease agents that a calf can shed once they get crypto or rota or corona and so on. And the cows don't shed nearly that much.
I was going to say, if you're interested in that, just email me and we will talk. We'll send you Dr. Garry's presentation last year, which covered a lot of that calf.
Right, that's right, because that was the topic. Yep.
That was your topic last year. We have his video that you can watch from last year too. We've got a couple questions here for you, Dr. Garry, in the chat.
Okay, I'll pull that up.
I'm just going to start with Katie's. She says they have a closed beef herd, and I would like to ask a question on what a closed beef herd is in a bit. But they do have wildlife such as elk that come through their pastures. Should they be worried about Johne's disease exposure?
There's a good question. I would tend to think that's a very low risk. I never want to make something 0, because I don't think that's plausible in biology. But what you would need then is to have a resident population of elk that have yonis. I haven't seen any reports of yonis in our wildlife populations except in some of the bighorn sheep herds. And though there too, it hasn't been really prominent. I think it's more common because of the animal density in some white-tailed deer in some of the Northeast, North Central states, because there's a lot of overlap between dairy cows where the population is fairly highly contaminated. So I'd be a little more worried about it there. But I still am not very worried about that in range beef cows for the following reasons. The bug is very environmentally resistant, but in our environments, typically we have a lot of UV light and a lot of aridity. And those are the two things that the bug really doesn't like. And so if you can get sunshine on things and you can get dryness, then the longevity of the bug in the soil diminishes a lot. Second, elk typically, will poop pellets. And so it doesn't typically contaminate. And these are just playing odds in terms of what the potential risk would be. It doesn't tend to contaminate the grasses that are growing. If you take cow manure and you distribute it through water or something else onto growing crops, then the bug will be on the crop and can be ingested by the cows. But in a normal sort of elk setting, they're typically not contaminating things that cows will typically be consuming. So when you take the risk in the animals being relatively low, the contact between them being relatively low, and the fecal consumption by cows of potentially contaminated elk as being pretty low, I'd consider it a very low risk. I'd be way more worried about things like with elk, things like transmission of potentially airborne diseases than the more fecal-borne diseases, which I think are relatively low risk in this environment. So since it's going to be hard to mitigate it, I'd leave that very low on my list of things to be concerned about. I wouldn't lose sleep about it.
So the next question was, do you feel that calf guard vaccination is effective on newborns?
It's marginally effective. You'll notice that the peak incidence of it, and I recommend it, the Scour Guard 3KC, and they're pretty similar products. Those are designed so that you can develop antibodies in the cow that are then secreted in the milk. So applied properly at the right time before calving means that the colostrum has an enhanced level of antibodies against those agents. Typically, those agents are going to be rotavirus and coronavirus. There are no vaccines made yet against crypto that are at all effective. So the rota and coronavirus and the E. coli K99 will have enhanced antibodies. But you'll notice that the peak incidence of calf scours is typically about 10 days. And the antibody protection that's occurring is primarily intraluminal, it's in the gut. So the antibodies the calf consumes that would potentially protect are pretty much gone by the time the disease has hit peak prevalence. So vaccines can help diminish the earliness of the onset of the disease, but typically don't much affect the likelihood of spread of the disease through the feces. I hope that answer was not too complicated, and please feel free to answer again, or ask again, but I would rank the vaccine as an important thing, mostly because I believe strongly in the Clostridium component, the K99 component, and I believe only marginally in the rota and coronavirus components. And I think the way more effective way to prevent rota and coronavirus transmission is through hygienic practices. And that's why the Sandhills calving is the one that I name, because there's good literature behind it. It's really well publicized. There are other ways to accomplish the same goal. It's my George Patton quote. Don't tell people how to do things, tell them what needs to get done. And so there are ways to beat that same game, which is to have newborn calves born on fresh ground that's not contaminated by incubator calves that have spread the infection a lot. I hope that is helpful.
Before everybody gets to logging off here, we're coming close to the end of our hour. There is a link that Beth put in the chat for us. If you click on that, you don't have to go away from here. It may pull it up. And you can just set that aside on your computer or your phone to come back to. We like to have that information, and I definitely like to hear what you guys want to have as topics as we continue these series of producer education. A couple questions that I have dealing with following up on that particular vaccination question that you just had. If you vaccinate cows in October, Dr. Garry, how likely are they still to have those antibodies produced when they calving in March and April?
Pretty low. Yeah, that's way too early. If they were heifers, I'd vaccinate them because you need to then booster the vaccine. But the way that works is as follows. If you administer a vaccine in a pre-vaccinated animal, so that's why for heifers, you need to vaccinate them twice, because you need the priming dose and then you need the secondary dose. Once the immune system has recognized the bug with the priming dose, it'll produce some antibody, but not an awful lot. So if it's the first vaccine you're giving, you don't expect a big response. You expect that it was primed. Now you give the booster dose. The booster dose is what now tells the system, yeah, you got the right cells, so let's do something here. And then they produce a tremendous amount of antibody. IgG, which is the primary antibody in colostrum, has about a 21-day half-life. So if you vaccinate the cattle in, let's say, October, then you'll get a really good response in typically about 14 to 20 days. So at about that time, 2 to 3 weeks, you're going to have a lot of antibodies running around. But now you don't have any further antigenic stimulus. You don't have a continued vaccine. And so the body says, yeah, we're good. So now you have, let's say, 100 units of a particular amount of immunoglobulin circulating in the blood by the beginning of November. In about 21 days, it will be 50. In about 21 more days, it will be 25. In about 21 more days, it'll be 12. By the time you get to calving in March, yeah, the antibody levels are really, really low. And as the cow produces colostrum, what it's doing is it's pulling antibodies from the blood. So the antibodies have to be very present in the blood in order for the colostral mechanism to work. The colostrum doesn't generate new antibodies. It removes them from the circulation of the cow. So the ideal time to vaccinate for things that you expect to be transferred in the colostrum is probably about 30 days ahead of the calving season. Why? Because in a well previously vaccinated animal, that gives you about that, say, 2 weeks to generate a pretty good immune response, and then about another 2 weeks to transfer it into the colostrum, which is about a 2-week process. So 30 days, maybe even 45 days, anything out beyond 60 days pre-calving diminishes the efficacy. And since you're going to have cows calving throughout the next 60, 80 days, the cows at the tail end of the calving have even poorer colostrum. So I would target it towards about 1 month before the beginning of the calving season for a booster dose is usually considered a pretty optimum response.
Well, with that, we are not going to run you off, but I think I'm going to have Beth stop the recording.
Okay.
Just so we don't run